Hello everyone, my name is Radwa. I did my presentation today on scabies, so let's get started. So our agenda for today, we will be introduced to our patient. We will discuss his symptoms, his physical findings, and how he is diagnosed and what is his treatment plan. So let's meet our patient. He is a 19 years old white male college student, goes by the name of JP. He's accompanied by his roommate, presents to our health clinic with the chief complaints of intense itching, painful red streaks between his fingers, wrists, around his umbilicus, and groin area. As per the patient, he reports that the itchiness is a lot worse during the nighttime. He also reports that his roommates, as well as several other students on campus, have presented with similar complaints over the past few weeks. According to the patient, he denies any allergies, he denies any past medical history, denies surgical past history, and is on no medications at the moment. For his physical examination, all his vitals are all within normal ranges. His general appearance, he is in no apparent distress. There is a reddish blister or pimples-like rash on majority of his upper body, which includes his perineal area. For clinical presentation, his hallmark feature of itching worse at night. Burrows, especially in between his finger web spaces, erythematous, and he has a linear marking in his skin with some scale on a flexor aspect of the wrist, finger webs, chest, umbilicus, as well as his genital area. So our patient is diagnosed with scabies. And what helped diagnose him with scabies is the hallmark features of the itching being a lot worse at night, as well as his clinical presentation. If we take a look back at his complaints, the itching was a lot worse at night. He had the linear marking in the skin that is mostly found on the wrist, on the finger webs, on his upper torso, and around the general area. If we also look back at his original complaint, where he complains, where he states rather that his roommate as well as other students have had similar symptoms as him. It also helps with diagnosing scabies as it is contagious. So how do we diagnose scabies? Scabies is diagnosed by visually examining the skin from head to toe for symptoms of mites. A sample of one's skin is removed. This procedure is rather painless. The sample is then examined under a microscope. What they're really looking for is to see if there are any mites or eggs present in this specimen. So how do we treat scabies? Treatment involves killing the mites and the eggs and eliminating the infestation with a medicated cream or pill. All medicated creams and pills or treatments must be prescribed for scabies. The treatments include permethrin cream or melatonin lotion, that are most widely used medication to treat scabies. It's a skin cream by chemicals that kill mites and their eggs. Permethrin cream is generally safe to administer to children over 2 months, and it's also safe to give to pregnant women or breastfeeding women. Sulfur creams. This medication can be applied overnight, rinsed off, and then reapplied 5 nights in a row. This medication is also safe to provide to pregnant and breastfeeding women. Ivermectin. This medication can be administered as a pill. It's used if the prescription lotion does not work. It's prescribed especially to people with crusted scabies or individuals who have low immunity. This medication is not recommended for pregnant or breastfeeding women or to children under 15 kilograms. These medications must be applied to the whole body from neck down. Creams must be applied for 8 to 14 hours a day. More treatments may be needed if new symptoms appear. Providers may also recommend treatments to all the household members or close contacts since scabies is contagious. The patient must also sterilize their laundry, wash and dry all their clothes with high heat. And those are my references. Thank you so much for listening. I hope you learned a lot. Thank you.